Okay, here is my audience for today.
Can you see me?
I think so. Yeah. Okay. So, today we are going to talk about bipolar disorder. What is bipolar disorder? What are the symptoms of bipolar disorder? How do you treat it? Bipolar disorder has roots reaching far back into ancient Greece and Rome, where texts were found describing extreme mood changes. The official name and understanding, however, did not come until the mid 19th century to the early 20th century. The official name was changed from manic depressive illness to bipolar disorder in the 1980s. Bipolar disorder, sometimes referred to as manic depressive disorder, is a mental health condition categorized by extreme changes in mood, activity levels, and energy levels. These shifts are more severe than a person would normally experience and greatly affect day to day life of someone diagnosed with the disorder. Mood can shift between episodes of mania, hypomania, and depression. Mania and hypomania episodes consist of feeling unusually happy, irritable, or energized, racing thoughts or increased talkativeness, decreased need for sleep, engaging in risky behaviors or impulsivity, grandiosity, or inflated self esteem. The only difference between mania and hypomania is the severity of symptoms. Depressive episodes consist of feeling worthlessness, hopelessness, or sadness, low energy or fatigue, difficulty making decisions or concentrating, changes in sleep or appetite, or thoughts of death or suicide. There is also a possibility of having a mixed episode, where you would have symptoms of both manic and depressive episodes. Bipolar disorder can frequently cycle through both manic and depressive episodes. There are four different types of bipolar disorder. Bipolar 1 is defined by manic episodes that last at least 7 days or require hospitalization. Bipolar 1 also often includes depressive episodes. Bipolar 2 is defined by hypomanic and depressive episodes. In bipolar 1, mania is more prevalent, and in bipolar 2, depression is more prevalent. Cyclothymic disorder, as well as unspecified bipolar, consists of milder mood swings of both hypomania and depression, but do not meet the full criteria to be diagnosed as either bipolar 1 or bipolar 2. Causes and risk factors of bipolar disorder are not fully known, but are attributed to environmental factors, brain chemistry, genetic predisposition, or trauma. Bipolar disorder also cannot be predicted. Even with religious medication adherence, a person with this disorder will still have both manic and depressive episodes. Bipolar disorder is a lifelong condition that cannot be cured but can be managed with treatment. Bipolar disorder is treated with a combination of medication and psychotherapy. Medications include mood stabilizers, antipsychotics, and antidepressants. Mood stabilizers are primarily used to treat bipolar disorder, but can also be used to treat schizoaffective disorder or impulse control disorders. Antipsychotics are primarily used to treat psychosis. Psychosis is a mental health disorder categorized by distorted perceptions of reality. Antidepressants are primarily used to treat depression, but can also be used to treat anxiety, insomnia, or chronic pain. Psychotherapy for bipolar disorder consists of cognitive behavioral therapy, family focused therapy, or interpersonal and social rhythm therapy. Cognitive behavioral therapy focuses on identifying and changing negative thought patterns and behaviors that contribute to mood swings. Family focused therapy focuses on improving communication, problem solving skills, and understanding within the family, as well as educating the family about bipolar disorder. Interpersonal and social rhythm therapy focuses on maintaining regular daily routines to stabilize mood and reduce the impact of disruptions of mood. Bipolar disorder affects nearly 5.7 million Americans. The condition can be diagnosed across all age groups, but typically presents around mid 20s. This disorder affects both male and female alike. Individuals with bipolar disorder have a tendency to have other comorbidities such as anxiety. They also have a higher rate of substance abuse and a lower life expectancy. Bipolar disorder can be a debilitating condition. 82.9% of those diagnosed have stated the disorder causes serious impairment.